everyone, the expanded function that I have chosen to discuss with you all today is radiographic imaging, also known as dental images, which are a necessary component of a comprehensive dental examination, as well as just being a part of the patient's permanent dental record. So the purpose of radiographic images is that it enables the dentist to see any conditions that aren't visible by eye in the oral cavity and to identify any conditions that might otherwise remain undetected by the dentist or the dental assistant, such as diseases and conditions that have no signs or symptoms and are typically only discovered through using the dental images. So that's why it's super important to know how to use this machinery and the precautions to take while using it, because it is super important to the patient and the patient's history. So indications that the machinery shouldn't be used. As a dental assistant, you should know to sterilize and clean everything after using it with a previous patient. So that's like number one rule. Everything should be clean. You don't want to expose your next patient to someone else's bacteria or any infections they may have. So it's super important that you have sterile sensor or film, sterile instruments, clean thyroid collar, clean lead apron. You need clean hands. You need to wash those hands before and after everything. Like, make sure that everything is clean for that next patient. Key steps to perform radiographic imaging would be to prepare the operatory with all infection control barriers. This is so that if anything was touched and not covered with a barrier, it has to be disinfected after the patient was dismissed. This is just to ensure that when the next patient arrives, everything is disinfected, everything is clean, which is super important. You have to determine the number and the type of images to be exposed through a review of the patient's chart for films or PSPs. And you should be turning on the x-ray machine to check the settings. You should be washing and drying your hands and dispense the desired number of films or PSPs and store them outside of the room where the x-ray is being used. So precautions that one should take while using this type of machinery. Dental assistants, and they should be making their patients aware as well of radiation effects. Dental assistants should be made aware of the radiation effects of this type of machinery that is being used. Although the amount of X-radiation used in dental imaging is small, biologic changes still can occur, which is why the dental assistant must be making these harmful effects known to the patient and how to discuss these risks with them as well. So it's important that you as a dental assistant and the patient does know the effects that that this machinery can have on their health, but most likely it won't unless the dental assistant did something wrong, like didn't put on their thyroid collar or, expose their eyes to the radiation. These are things that you should be taking precautions as a dental assistant and to ensure the safety of your patient. So post-operative instructions that one should be taking. You should be asking the patient to take off any prosthetics from their mouth, such as retainers, dentures, any tongue piercings, anything like that. Their nose piercings should be taken out. Their earrings should be taken out. This is just to ensure that none of these things are getting in the way of the radiographic images. And you should be seating the patient comfortably with their head back in an upright position. And you should just make sure that you put your examination gloves on before opening the package and assembling the sterile film and sensor. So there's a lot that you should know before just sitting down the patient, and those were some of the things that I had noted that were most important. Potential risks or harm to the patient would be if the skin is exposed during dental imaging. The effects of radiation could be similar to sunburn on their skin, so it's important to not have any skin exposed during dental imaging. If that thyroid collar is not being used, the radiation dose to the thyroid gland could be significant to that patient. So it is super important that you put that thyroid collar on and make sure that the thyroid gland is not exposed to the radiation. The eye is very important to keep covered through radiation because the lens of the eye can receive cataracts from high exposures of radiation, and radiation can also change bone marrow as well. It can have a result in bone marrow and result in leukemia. So it is super important to just take these precautions for your patient and for yourself when working with this type of radioactive machinery. Alternative materials or techniques. Some techniques that I found that are helpful with radiographic images would be the positioning. I know that's something a lot of dental assistants really said they struggled with for some time, was the positioning of, the instruments in these patients' mouth. It's a tricky process and it takes lots and lots of practice. And some techniques with that, the patient is mid-sagittal plane, should be perpendicular on the floor, which means that the patient's head is upright for the maxillary films and tipped back slightly for the mandibular arch. Those were some tips that I found worked for some people while reading some tips out of the book. The level of supervision is indirect supervision, which is a licensed dentist must examine the patient, diagnose a condition to be treated, authorize the procedure to be performed, and be on the premises while the procedure is being performed. I actually think that this supervision level is very much needed while taking radiographic images. It is important that we have this supervision while working with radiographic imaging because of the high radiation levels that one can be exposed to and the precautions that one needs to take with the patient and with yourself in order to ensure your safety while taking, these images that are high radiation levels. So it is super important that we have this supervision as students to ensure that we have a full understanding of the precautions that we are supposed to take while working with such machines like this that have such high exposure of radiation levels. So it is very important that we do have that indirect supervision, and I think it is very much needed for radiographic imagery. Thank you so much, and I hope you enjoyed my video on my chosen expanded function, which was radiographic images, and I hope that you can all learn and take something away from this video. Thank you so much.